There you go.
All right. So good morning again, everyone. My name is Alixe Dittmore. I am the Director of Community Outreach for Greater Hartford Harm Reduction Coalition. Our home basis is in Hartford. We have two brick and mortar sites, one in the south end of Hartford off of Park Street and the other in the north end off of Albany Avenue. And then beyond that, we have 15 to 20 like roaming mobile sites for what we do. So as a harm reduction agency, we do a lot of different things. So we primarily are working with folks who use drugs as well as those who are experiencing homelessness. We also serve anyone in the community that needs help. So it's not like you have to be dealing with substance use in order to receive any of our other services. We do homelessness verification and homeless outreach. So that applies to anyone who's, unfortunately in that state, including families. This year we are running, we've been contracted to run the Hartford Emergency Shelter. So we are overseeing one of the floors at the Best Western Hotel. And then of course, working with folks who are using drugs, we do things like getting them linked to medication-assisted treatment, such as, let's say, Suboxone, Vivitrol, or methadone. We also help folks get into detox programs, and whether that be, intensive outpatient, or that could be long-term residential, medical detox, stuff like that. Our biggest thing is that we work primarily in that gap between folks who are not engaging in service and are very hesitant and reluctant to engage in any sort of services, and trying to bridge that gap into receiving the services that they need, whether that be housing or things just as simple for us, especially as skin infections, wounds, things like that, where they're very hesitant in order to seek medical care. They're very afraid to because of the stigma. So they think that they can handle it themselves, and then it gets worse and worse. So we really try to alleviate that and build community partnerships ourselves. So that way, instead of saying, oh, you have to go to a clinic, I can say, hey, I can walk across the street with you to community health services. And I know Dr. Klein really well. We have so many people that have worked with Dr. Klein. They love him. He will treat you without stigma. He'll help you treat your Hep C, even if you're still using. So that's something that I really like, is that we have a very strong basis in warm referrals, because with our population specifically, if I do something to show that I'm not looking out for you and you feel like you can't trust me, I have to re-earn all of that rapport and trust again. And it is twice as difficult, because, this is a lot of folks that are in survival mode. Beyond that, we also have groups. So peer-based groups for folks that have been incarcerated, people that are still using, and recovery. We also are very much affiliated with NA. We don't push that because it's not for everyone. For us, we just want to keep you alive. So we also supply things like sterile drug supplies. So that would be syringes for those who are injecting drugs. We do that specifically so that way we're reducing the transmission of HIV, Hep C. I don't want you to be reusing products, because what it's going to do is introduce bacteria into your bloodstream. That's how you can get endocarditis and a whole lot of other health issues. So we really look to reduce any type of harm possible. I want to keep you alive. I'm going to give you Narcan, which reverses an overdose. You can't recover if you're dead. It's a lot more difficult to recover if you have a chronic disease such as HIV or Hep C or endocarditis, and now you have a pacemaker at 26 years old. Those things are a lot more difficult. So for us, we just want to keep you as safe as possible, given risks that we might be taking. And we don't push anything on anyone because it tends to push them away. I offer you all the tools I have. So with that, we had different types of questions. Obviously, that was something I was very excited about with the survey, is that we got to choose specific questions for our agency specifically. So what are things that we wanted to know about our populations? And I'm going to be sharing my screen so that way I can show you all some slides. My slides are mostly just the survey results, because I tend to talk about the rest of it to kind of give some more context. So let me make sure this is working. Can everyone see this?
Yes.
Yes.
Yes, okay. I'm going to try to make this full, pardon me, like the little Zoom thing is right at the top, so I can't see how I can just put it into, display the slideshow. So don't mind me.
If you go to the bottom, you'll see a screen, a symbol. Yeah, click that and see what happens.
Yes, thank you. Okay, all right. So make me minimize this so no one can see it. All right, everyone can see everything. Good. So again, I was very lucky. I got to have one of the medical student candidates, Anita, who helped me. She was great. So we still did all of these surveys in person with the types of services that we offer. We did not shut down at all during COVID. We just drastically adapted how we did things. So that made most of what would happen in our drop-in center. We, tripled our street outreach, things like that. And we did so many precautions of making sure we knew everything about, COVID guidelines as they were being released in real time, because this was March and we were still learning as we were going. So everyone was wearing masks. We were sanitizing everything. Everyone got their, temperature checked at the door. We provided them a mask if they didn't have it. So we took all the precautions that we could, and we adapted them as we knew more in order to still provide those services for people. So again, our surveys were done in person. We had air circulation, distance, masked, and we did 88 of them total. So with that, where our center is, I think it's important to provide a bit of context. So I'm not sure how many of you are familiar with the north end of Hartford and Albany Avenue, but we are located on Albany Avenue across from CHS, which is Community Health Services. Where that location has a lot of foot traffic, a lot of drug traffic, as well as a lot of gun violence. There's definitely been an increase in gun violence, I would say, in the last year with COVID, unfortunately. So we have a high foot traffic area, and we have a lot of folks who come all the time. So I just wanted to show you just a little bit of demographic, like Dr. Shenschel had previously said. Primarily the folks that we are engaging with are Black folks and Hispanic or Latino folks, and usually a bit older, so like middle-aged, 40, 45 plus. So that tends to be a bit of a different population than most, because I come from the world of HIV work. So the frequent service users, this was really, really helpful for us to, I'd say, put a number to. I know that we see hundreds of people every day. Before COVID, we would literally have over 100 people that would walk through our door a day. And this 81% of people who visited several times a week or daily, that was affirming, because I know the people that I see. I just didn't realize that out of 88 people, it was really that many people that come and see our services that much. Obviously with, quarantine, isolation, the shutdowns, people contracting COVID or being exposed to it or just being afraid, we saw a reduction in that, and that's why we went to the street more. This is just a list of, some of the services that we offer. So using the bathroom, this was a big one. So for us, using the bathroom is twofold. One, during COVID, a lot of places closed, so people did not have access to bathrooms for things just like freshening up, urinating, brushing their teeth, things like that. Additionally, in public spaces, many folks will engage in their drug use in a bathroom because it's a private space. You can put some things out, and I'm talking about primarily people that are experiencing homelessness. They don't have a space to be. The reality is a lot of that happens in bathrooms. That's why at our facility, though we don't say go in and do things, the reality is it might happen. So we have a very strict bathroom policy where it's every 3 minutes. If you go in there, no matter who you are, I'm going to knock on the door. I need to hear a verbal confirmation that you're okay, just in case we do have an overdose, because we have had overdoses both in the facility as well as certainly in the community around us. So that's why I wanted to just draw attention to why we emphasized using the bathroom specifically with this one. So again, we talked about Narcan training, condoms and safer sex supplies, obtaining, cleaner syringes, safer smoking kits. The HIV and Hep C testing, especially with COVID, went down a lot because it was a lot more difficult to try to find a safe way to be in a room with someone for an extended period of time, because all of our screenings are rapid point of care, which require a 30-minute window. So that's, in my sessions always include a risk reduction counseling component. So my sessions with someone typically could last like 45 minutes. And with COVID and it being so new, it was very difficult to try to find a way to still make that safe and to still also provide as quality of care for people as we could. Because for our surveys, this happened literally, we were right in April, like the very beginning of April and March that we started doing this. So for this, it's just a quick use of roughly, the types of drugs that our folks use. The 70% heroin, 49% fentanyl. I'm going to tell you right now, a lot of folks think that they're still utilizing heroin, and it absolutely has fentanyl in it, especially in Hartford. Everything has fentanyl cross-contamination in it. We also have crack cocaine that now has fentanyl contamination in it, and we have had people that have died from a fentanyl overdose who have only ever been a solo substance user of stimulants. So that's quite scary. But I like to explain that because I feel that if you just look at the heroin versus fentanyl, it's a bit misleading to what people are actually utilizing. And again, at the bottom, what I found interesting, because this was the beginning of the pandemic, it said that only 18% of people were using more drugs. And later we're going to see how people's mental health was impacted by it instead. All right. So changes to their drug use behavior. So another important thing that I think for people to know, and as someone who works in the field of harm reduction and with folks who use substances, I like to bring attention to the fact that it is not some grand, we're chasing this high to feel great all the time. 51% of people experience withdrawal because they can't afford or get to their drug of choice. I know there are plenty of people that think, well, that's what's deserved. The thing is, withdrawal is incredibly painful and difficult, as well as at this point, quite dangerous with fentanyl. We're now seeing a lot more people that are having severe seizures and physical reactions due to fentanyl withdrawal specifically, which is quite scary. Alcohol withdrawal, as well as benzodiazepine withdrawal, is similar to that as well. People can actually die from both of those types of withdrawal. So it's more than just not feeling well. Additionally with that, when I was conducting these surveys, because I conducted most of them, a lot of people had a hard time differentiating if they were feeling, dope sick or experiencing precipitated withdrawal, or if that was a COVID symptom, because a lot of them smoke all the time too, cigarettes, amphetamines, things like that, and they also live outside. So many of them have had chronic coughs for a long time, or they have COPD, or if you're feeling dope, or you get the chills, you can get a fever, you can get diarrhea, gastrointestinal issues. So with both symptoms kind of overlapping, it became a bit more difficult to see what is what. Additionally, what's always terrifying for me is using drugs alone. So 52% of people using drugs alone. We never want people to use drugs alone. And of course, something like drug use tends to be quite isolating. The issue, obviously, with using drugs alone is that if you have a bad reaction or you have an overdose, there's no one there to save you. So that has definitely been our largest fear for our populations with COVID, is just the drastic increase in both non-fatal overdoses as well as fatal overdoses. Again, with mental health status related to the shutdown problems. So there were higher scores on depression and distress, and it was related to the shutdown problems. I will say also anecdotally, as someone who's delivering these surveys, and I definitely talked to Dr. Schenschel about this during it, I was really taken aback and surprised yet not surprised at the sheer emotion that came from people. I had multiple people that would begin crying with me, talking about their honestly fears of their own morbidity, as well as fears of people that they love dying because they know that they live in lower income areas. They know that they already have comorbid health issues. They didn't feel prioritized. And a lot of them felt like they couldn't trust, like their government at the time, particularly the president and things like that. That was very popular, was a huge distrust. And as we know, especially in Black and Brown communities, there is a distrust of both government as well as the medical system, and with good reason, and unfortunately due to a lot of historical issues that have occurred. So again, I just want to reiterate, yes, of course, this is just at the beginning that people were beginning to feel more depressed. I will tell you, it has absolutely increased by far. So some large takeaways, and I am taking this strictly from the presentation that was given to us because Megan and Anita did a phenomenal job of wrapping everything up concisely for us. So we did have folks that they felt that they had a high likelihood of getting COVID. And so this specifically, like right underneath how it says, the opportunity to increase knowledge. This was really helpful because of the survey, we were able to talk about, okay, if you're worried about getting COVID, I see maybe in the survey later on, you actually did not, say that you're doing as many preventative measures. So what is prohibiting you, or what is a barrier for you of getting those preventative measures? Do you need access to masks, gloves, things like that? So what we did at our agency was we started creating COVID kits, and these were not just for program participants. These were for everyone in the community. So we have kits that we would give out that had 2 things of hand sanitizer, 2 bars of soaps, 2 masks, and 2 sets of gloves, as well as a pamphlet that we created with the most recent COVID information that we had from the CDC. We did this for everyone because we just wanted them to kind of have either one, a bit of no excuse to not utilize it if you had it. And then for others who, just genuinely did not have access, now they have it and they can still protect themselves as well as their loved ones and community members. A big thing with this as well was, of course, like they said, a good messaging around protecting family. Everyone was very worried about their family. It seemed to be that, I think it's quite typical, people were worried much more about their family and their loved ones than themselves, particularly with some of drug use and with them living outside. This was another big issue, is that, of course, precautions for COVID, they look very, very different for people that have housing and for people that don't. For people that don't have an option of not utilizing public spaces for their basic needs. People that where in the winter, you have to congregate, let's say like under the bus stop where there's some sort of heating, you don't have an option or the luxury of being distanced all the time. If you live in a campsite with people, maybe you have to share a tent with somebody, or at least close proximity. You don't have the luxury of saying, well, I'm going to get another tent, we're going to be 6 feet apart. Your bag gets stolen, things like that. There's a lot of other things. So we really adapted to what it is our people need. And so we started pushing a lot more about wearing masks and distance. So a lot of you are outside, a lot of you are living outside, being outside most of the day. Are you staying distance at least, and talking about the importance of, like that airflow, in order to make sure that if you're respirating, you're not going to have these droplets spraying directly into your friend's face, or recirculating in a room. So it's quite different. Oh, and then that is it for my slides.
Okay, thank you so much. Are there any questions? Let's see. I'll look in the chat here.
Alex,
I think because of our short time, let's see, any hands, any questions? Oh, I see ones. Okay, Steve.
So Alex, although I think it'd be interesting to ask this question to all the participants, how do you translate this into the vaccine and getting people vaccinated in this unique population in which they're used to injecting drugs?
Mm-hmm. So for us, we did, well, twofold. So one, we always kept up with where our mobile testing sites were, especially when they were setting them up in parks and in the community. We always let people know where to get tested, so that way they could get tested, because we couldn't do that at our own facility. Luckily, directly across the street, they did that. And that's the case for actually both of our brick and mortar locations. We're directly across the street from a health agency. So that's very lucky. For the vaccine part, so I was in charge of registering our agency actually for vaccination access. The majority of my agency we are a majority Black and brown agency. I'm one of only, like 2 or 3 Caucasian employees. So really it was peer-based experience and knowledge. Everyone that I work with chose to utilize getting the vaccine, and they really just started talking about it with their friends and with their community members, and being an open book when they had questions about it, and also not like just saying immediately you need to get it, but really making a lot of space for what are your hesitations with it. Is there information that maybe we could kind of look up together that might not appease but alleviate some of those worries? Or is it really just, I want some more time? And honestly, I don't blame you if you want more time. So if they do, then we talked about, okay, if we're not going to go for the vaccine, what are things that you can do to keep yourself safe? Double masking, continuing quarantine, stuff like that.
So it's very much on the agenda.
Oh yeah.
Of GHHRC.
Yeah, my boss especially is like, come on people, we've been stuck inside all the time for a year. Like, we're so used to as outreach people doing so many different, we would have like parties, like community block parties, going to different events, holding all these things. So for us to all be stuck is wild. it's really wild to like not have a drop-in center where everyone's just congregating like how it always was every day. So we're just consistently trying to adapt to find safe ways to bring those things back to people.
Alex, someone in the chat asked if there's testing available for that population.
For COVID testing?
COVID testing.
Yep, so for COVID testing, we don't utilize that. So we're just a regular CBO. We just recently got an RN on staff, but before we are all just peer-based knowledge folks, or folks with lived experience. Many of my coworkers and colleagues are people with lived experience with injection drug use, substance use, homelessness, incarceration. So for COVID testing, we just can only give them a whole bunch of resources on where to go and guide them there. A lot of folks have been tested, especially because they have to be tested if you're entering into like, you know, the warming shelter and like the hotels and stuff that they're having now with COVID, as well as any detox programs, things like that. Everyone has to be tested. But that took time. I'll be very honest, that definitely took multiple months. But I've still been offering HIV and Hep C screenings. That is what we are licensed to do. So I hope that answers that.
Okay. Well, thank you so much. We really appreciate it. That was really interesting. There may be more questions in the chat you may want to answer as we move on, but we got